Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have a very exciting session with Dr. Gurevich. Dr. Gurevich, thank you so much for joining. And on that note, the floor is yours to take away.
Thank you so much. Happy Friday, everyone. I'm also known as Dr. Gigi. Thank you for taking your time to be here tonight to listen to my story. May this ignite your passion in pursuing dentistry. I hope this gives you a better look at how you can serve yourself and your community, how you could change your life and so many others around you. I don't know if any of you have ever shadowed before, but it's an eye-opening opportunity. I wish you all get the chance to shadow. Due to the pandemic, I know it's extremely hard right now. And feel free to reach out to me if you have any other questions. Dentistry has been part of my life, so I'll start from the beginning. I was born and raised in Miami, Florida. I attended David Fairchild Elementary School until I was in second grade. Then third through fifth grade, I began an English-Spanish bilingual magnet program at Sunset Elementary, preparing me for the Big Sister School at Carver Middle. I went to a different high school than my middle school friends, branching into a business magnet at Southwest Miami High School, where I was a cheerleader in numerous clubs and a few AP classes. And straight from high school, I started community college, graduating with my AA in business administration. From there, I was at a turning point. I wasn't sure what I wanted to do. I loved working with people. I loved event planning. I loved science and healthcare. I love dancing, art, painting, cooking, pretty much a variety of different things. And most important, I wanted to find a career that would allow me to give my future family an abundant upbringing in which I was so fortunate to live. I had to make a decision and I applied to Florida International University. It was going to take me about 3 to 4 years to complete a bachelor's in science due to my class selection in my associates. Then take my DAT, pass my DAT, apply to dental school, and get into dental school. Analyzing my options, I was presented with opportunity to study in the Dominican Republic, where my dad also went to dental school. And at the time, I was 20 years old, and I decided, hey, let's go study abroad, learn the Dominican culture, and live a different kind of lifestyle. Is going to be great for right now, and it's going to be an amazing growth period for me. So what is a general dentist? A general dentist is a professional who does a variety of procedures on your teeth. In reality, you integrate the mouth, face, and body. When your patient comes in, you need to know their vital signs, their medications, their daily habits, their social history. And it's important to have a good medical history to better evaluate your patients. Under general dentistry, we do different procedures, like I mentioned, like crowns, which is a cap that goes on top of your tooth, or fillings, which can be white or silver. Now, mainly we do white fillings, extractions, taking out your teeth, root canals, removing the nerve from inside your tooth, or dentures, something that's removable. And also we have specialists, which are people that are really focused on what they do and they're experts on these procedures. And some of these are orthodontists, which do braces, maxillofacial surgeon, which can take out your wisdom teeth or do different kind of surgeries within the mouth that are more extensive, facial fractures and traumas, endodontists, which are very good at root canals, periodontists that deal with the gum, bone, and how to make everything heal really nicely, and pedodontists, which are specialists in kids. So not only did I decide to become a dentist, I decided to move to a third world country and graduate as a foreign trained dentist. I knew I would have obstacles and that this process of returning was going to be more difficult. What is a foreign trained dentist? A foreign trained dentist is someone educated in another country that receives their degree, and in order to practice in the United States needs to go through a CODA accredited program, such as an advanced standing, GPR, or an AEGD. Living in the DR, I knew that this was going to be a monumental time to live on my own. I had to walk to school, I had to take taxis to and from different, from my apartment to the grocery store, which was a very big change from living in Miami. And throughout that, I had to speak Spanish all day and deal with learning how to integrate my Spanish in the clinic with my patients. It was a complete lifestyle change and a challenge, and I loved it. I met so many people, and few of which I'm still in contact with and will be branching into the next part of my career. And I'm so blessed to have been through this experience. Now, after getting your degree in the other country, like I explained, you have to come back and do a residency. And prior to your residency, you need to pass both boards or now the combined board and then get into a program. And that's really where my story continues. I worked with my dad and I was struggling to pass my boards. I lost confidence in myself. I was under a lot of pressure to get into a program and pass my exams. I wanted to move forward with my career. Hold on, I'm doing a little bit of back noise. Okay. So I was under a lot of pressure and I wanted to get into a program and pass my exams, and I wanted to move forward with my career and my life. And I failed my first board on the first try. Give me just 1 second. I'm hearing some about this. Sorry for that. Okay, so then after that, I took my first board and I didn't pass on the first try. I passed it on the second, and then the second board, I failed 4 times. I decided that I've had tutors. I have tried every method of studying. I read all the books, and the only thing I hadn't changed was my environment. So in June 2017, I think it was, I moved to Atlanta with my brother. And a month and a half shortly after that, on August 29th, I finally passed on the 5th time. And this was my time, all my loose ends tied up. This was the time for me to apply to programs correctly. I had applied several times before, but only with part 1. And I had some interviews, even though I just had part 1, but I just kept getting rejected. I was preparing to change my career paths, and the doors opened for me and everything started to align. I applied for jobs, and then Dr. Mariana Kovic and Dr. Dina Giesler interviewed me, and they taught me the ropes. They built up my confidence. They took me to many continuing education courses on oral sleep apnea, cosmetic dentistry, such as Aesthetic Advantage in New York with Dr. Larry Rosenthal. They also took me to a course on orthodontic appliances with Dr. Rondeau, and he has a really cool lab in Canada. And this uplifted my faith and inspired me to explore more of myself. I was able to move past my fears and my negative self-talk. And this all helped me through yoga, meditation, and mental health care. In November 2019, I received the best phone call from Dr. Souza that I have been accepted to the University of Florida in Hialeah, which is 30-40 minutes away from my house. So it's amazing. And what a ride. I could finally see the light at the end of the tunnel. In 2020, this was my year. Shortly after starting the program, I met the dental yogis. If you don't follow them also on Instagram. And I found them on Instagram, and the Revive tribe boomed. They have connected oral surgeons, endodontists, general dentists, pedodontists, and orthodontists, and pretty much anyone and everyone in the dental community. They are mindful practitioners who promote wellness into dentistry, creating paths through yoga, mind and body, and movement and meditation. This is known to help patients and dentists through anxiety. This story is for another day, more about that, but in summary, they connected the most amazing people, and from all forces of the world, or all places in the world, we united and met in the Dominican Republic, where I went to dental school. This was also a coincidence. And we did a dental yoga community service mission trip in February 2021, which was so successful. We were able to bring clothes and food and just serve our community. And we were able to perform, I think it was 200 extractions. We delivered 50 dentures. It was amazing. And at this point, now I can see that I need to take every path and every turn and every obstacle in order to be where I am right now. And I'm also part of a community yoga group that raises mental health care awareness. And I work with crystals, and I feel all of this is bringing me to who I am. And to be honest, at first I didn't know what I wanted to do. I knew I liked dentistry because I had been around it at my dad's office, working as a dental assistant and patient coordinator, but after that, I wasn't convinced, was this really what I wanted to do, or was it something that I was falling into? And now I can look back and see how much dentistry has actually changed my life and better me as a human, healer, and provider. And with a grateful heart, I can say I fall more in love with dentistry every single day. My advice for you is to join a study club where you can learn from other dentists and find a mentor. Instagram is an easy, cheap, and quick way to get started on your networking. And little by little, you'll find out what you do like to do and find your tribe of like-minded people. And for some of you, figuring out your interests takes time. And for others, you instinctively already know. I suggest that you prepare for your DAT and apply early. Visit schools, shadow, volunteer. It's important to learn how to deal with all kinds of people and get involved with your community. Figure out, do you have a mentor? Do you need a mentor? Do you know how to ask for help? Reassess your goals and define them with a time frame. What I cannot stress enough is do not sacrifice your mind for your work or for your studies. Try to find a balance in your work life and your personal life. Then how to integrate the two of them. Study to be knowledgeable, study to teach, study to learn, and lastly, organize. Organize and plan and stay ahead of the game. I'm a person that likes to arrive early, settle in, and get my body, mind, and everything set for the day. I review my patients the night before and the morning of to see what has changed. Dentistry in the schedule is pretty fluid. You can have something 5 minutes before and the patient will cancel, and then all of a sudden in general dentistry, you can have totally different procedure in 10 minutes. There's a recipe that we should follow. Evaluate their chief complaint, their why. Why are they here? Are they in pain? Are they looking for something? What brings them here? Their subjective, their objective exam, and prior to assessing the problem in order to determine their diagnosis. The key is to keeping all your patients documented and analyzed correctly consists of taking records and photos. At the University of Florida, we have specific days for each specialty. On Monday, we alternate oral surgery, periodontist, orthodontist. On Tuesday, we have oral surgery and prosthodontist. On Wednesdays, we have a little bit of everything. So if your patient needs to come in for Invisalign or for an emergency, Wednesday is probably the best day to schedule them. Thursday is root canal day, and Friday morning, we have patients, leading to the afternoon, which can vary from treatment plan presentations, evidence-based dentistry, just a little bit. Today, for example, we did a phlebotomy class, which was really exciting, and we were able to play with, try taking out blood from one resident to another, and I think hands-on courses are just a lot of fun. The first year of residency consists mainly of lectures and some patient care versus the second year is mainly clinical. And finally, at the end of the day, I check my notes. I make sure that everything's written down. All my charges for whatever procedure I had done is written down and swiped by the faculty. and I pour up impressions and send out my cases to the lab. What kinds of complaints do patients present with? Patients will come and they'll have a complaint, I need to take out all my teeth. I have headaches when I wake up and they don't notice, but they might have been grinding or clenching the night before. I have gaps in between my teeth, so maybe they need braces. Doctor, I want veneers. The last option I got, they said I have gum disease. What can we do? So these are types of complaints that patients will come with, and then we'll evaluate to see if they have cavities. Do they have gum disease? Do they have bad breath? Do they have a trauma? Were they in a car accident where they hit? And is their bite okay? Do they have an overjet, an overbite, different classifications that we analyze when we're just talking to the patient and checking them out. What kinds of procedures do? I do a lot of procedures. I start off with the complete exam, which is called a COE for short. And in the complete exam, I check all their teeth, see what teeth are missing. I mark down what teeth have cavities, or I mark down what teeth have been broken, and just analyze their tongue, their jaw, their forehead, their neck, their glands, everything. I make sure that I write down all their medications and any allergies. A POE differs because that is a periodic exam. So if you go in regularly to get your cleanings done, normally they'll do a periodic exam once a year, and they'll just check to make sure that everything is stable and within the limits from when you did your complete exam. I also perform scaling and root cleaning, which are deep cleanings, composite restorations, white fillings, fixed and removable prosthesis, complete dentures, which I have fallen in love with, endodontist or endodontics, which root canals and nerve specialties, extractions, taking out teeth, socket preservation, making sure that after we take out the tooth, that there's enough bone and tissue to support an implant if we're going to place one in the future. These are a few of my tools that I use for diagnosing, and these are instruments. So instruments like you use to play the piano or the flute, dentists use instruments and tools. Tools like a mirror, an explorer, a tissue plier, which I put there on the presentation if you can see. On the left-hand side, I put a picture of a model. So this is what we call a diagnostic cast for you to analyze before you do a procedure or while you're planning and deciding what you're going to do to your patient. And on the right-hand side, I put a picture of a cone beam CT scan, and this is basically your guidebook to see how much bone there is and if there's any pathologies within that patient. And at the University of Florida, we send out these images that are scanned with our CBCT machine to the radiologist. And the radiologist writes us a report and lets us know if there's anything that we should be concerned with and we need to send out to a specialist. New technology, very exciting. Our clinic just got the newest OmniCam fluoresceric machine. So that is a scanner, and it basically takes a video of your mouth. So if you're gonna do a crown, this allows you to take, instead of taking putty and all of the impression materials, which sometimes is still needed, if it meets the requirements, you can scan and take pictures of your preparation of where you drilled around the tooth, and it sends it to a computer system where you can analyze and mark where you want and how you want and design your crown and mill it in the same office, which is super cool. And then on the left-hand side, I put a picture of an iTero scanner, which this allows you to do very similar things, except you don't mill it in the office. You digitally send the impressions and the scans off to a lab, and they will 3D print it for you and send back your information. And on the right-hand side is an image of what a CB cone beam CT scan is. And this is gonna allow us to better see if my patients or our patients are candidates for implants, see if there's any pathologies, or really just dive deeper into my patient's concerns. Important terms in dentistry for me is simply seeing a tooth, and you can see the cusp, which is the bumpy part of the tooth, the enamel, dentin, gum, pulp, cementum, periodontal ligament, alveolar bone, and apex. So what is all of this? The enamel is the thin outer covering of the tooth. This is a tough shell that is the hardest tissue in the human body. It covers the crown. It's the visible part of the tooth outside of your gum. The cementum is a specialized calcified substance covering the tooth, and it is part of the periodontium that attaches the teeth to the alveolar bone by anchoring the periodontal ligament. And basically you have the crown and the bridge. My first case that I'm going to show you, this is a patient that needed to change out her front anterior composite restorations. And this type of preparation is called a class 4. And this technique takes you through the preparation of the tooth surface. Then you can use different types of composite material, which can be microhybrid or nanofill composite, to start building up the tooth, the back or the lingual part towards the front or the facial aspect. And this is so important to layer your composites in the front. That way you have perfect translucency or opacity. So translucency is more of the like lighter colors where you can see through, and the opacity is more white and you can't see as much through. And like I said, it's really important, and that way you can have perfect color match. And if you don't know what a drill is, it's basically if you're going to drill into a wall, we have the same thing, but drills into teeth, and they're just little components that we use in order to make the surfaces exactly where we want it to be. And also with this case, this patient, she presented with her upper left side with a bridge, and it was no longer viable. It was not doing really well, and she had an infection underneath it. So about 4 to 5 months ago, I took off the back part of the bridge, and I left the front tooth, which is her canine. I left that crown on since it was still okay at the moment. And eventually we are going to replace that crown for a new one. And so 4 to 5 months after we extracted the tooth, we decided that we were going to place implants, and we did a cone beam CT to evaluate the density of the bone and see if she was really a candidate. She's also was a smoker, and prior to the implants and prior to the composite restorations that we placed, I'm very excited and happy for her. She quit smoking. So if you see in this picture as well, going back, you can see the difference between the top photo and the bottom photo, that her teeth were much more yellow than the bottom teeth. So I'm really proud of her because she also has allowed for the healing process of the implants to be much better, and just the healing is so amazing. So today, reviewing what we did in our lecture in our phlebotomy class, we were talking about LPRF, in which this system extracts we extract the blood and we put it in a machine called the centrifuge, and it spins around and it takes out the white blood cells, or separates the cells in there in order for you to use the correct ones in order to make a sticky bone or to make a plasma membrane, just making the healing process so much better for your patients. So in these images on the top right, you can see the implants are placed about 1 millimeter underneath the bone. And then after that, we put a little screw on the top. So the implant is basically a screw, and then we put another screw, a cover screw it's called, on top of that so that the bone and the tissue doesn't go inside of it. And we took out some blood from our patient, and I made a membrane, and we made some sticky bone. The bone that we use is Mineros. It's an allograft material. It's a combination of mineralized cortical and cancellous bone that is osteoconductive for a scaffold, providing volume and enhancement and development for a successful dental implant. And after that, after I place the bone, we place the membrane that I used from her blood. Then we used a non-resorbable membrane on top of that to protect it. And we used some PTF sutures, and you can see the top picture on the right is the day of placement, and the one on the bottom is 10 days later, and you can see the tissue is nicely healing. On my second case, I have a patient that she was asymptomatic, meaning she didn't have any pain or discomfort, and she just wanted a complete exam. So she wanted to have all her teeth checked out. She hadn't been to the dentist in over 10 years. And this type of image is called a bite wing versus a periapical that is a longer, and you can see the entire roots. But this is a bite wing, and you can see that gray area and the middle tooth, that's radiolucency, and that's due to decay. It's because of cavity, it's caries. So the left picture, that was in the middle of the treatment, just removing all of that decay and all of that caries. And unfortunately, the patient did not have the financial resources to restore that tooth. So we ended up having to take it out. And for me, these are the hardest cases because you feel bad for your patient and you learn a lot from it. You are just trying to do the best that you can for them and remove as much cavity. And unfortunately, it led to taking out a tooth. But at least she wasn't in any pain. And it's just really hard to save something that the patient is not able to keep. This is probably one of my favorite things to do now in dental school in the Dominican Republic. I knew how to do dentures. I did a handful of dentures, but I wasn't as comfortable or knowledgeable in it, and I didn't like it. I didn't like it at all. And now I'm in love with doing dentures. To do a denture, on the left side, you can see that was his previous denture. He didn't like it anymore. It was really yellow. It was old and defective, and his bottom teeth we ended up having to extract because they had cavities and those teeth were no longer restorable. They had infection, and really to build up those teeth was not going to give him a good prognosis. So we decided that we were going to make him a brand new smile top and bottom denture that he was very happy with. He was able to select his tooth color and tooth shape as well. And to do a denture, the first thing you do is you're going to take an impression. If anyone has ever had an impression, you make it with alginate. So it's a powder and liquid, and you have different measurements, and you mix it. And if you've had braces before, you know what an impression is. So we do a preliminary impression, and we take that alginate, we pour it up, and we trim it. Then after that, we make a custom impression tray for them. And we have to understand the principles of where we're trying to copy and what we're trying to copy in their mouth. It has to be real precise, and we call that border molding for their custom tray. And with that, we do what's called boxing, and we get wax and we box. Underneath the pictures of the patient, you can see they're pretty small, but gives you an idea of all the steps that we take in order to make a denture. So we box it up, we pour it up with stone, and then after that, we make their wax rim. So we put wax and we make it nice and flat, and we just relate the top and bottom jaw. I check the sides to see if the patient is too bulky or too in. And I like to at least select the teeth with my patients and and make sure that my patients are happy with that. Also, properly adjusting your wax rims. You want to get your incisal edge, which is this edge here, for your occlusal plane, your vertical dimension of occlusion, your midline in the middle, your smile line, your canine position, and just, I'd like to have a checklist and make sure that we're checking off every step along the way. My fourth case today, I have